Hey everyone, hi there, it's Dr. Jen with What's Up Wednesday. Welcome everyone. This is going to be, I think, a really informative Facebook Live today. Lots of information and tips for parents with kids. It's going to be all about the stomach bug. And last week we spoke a lot about the flu, which was really great. I got lots of comments. It seemed like people really got a lot of information. So today I wanted to talk about the stomach bug, even though some people call it the stomach flu, and it's actually not a flu. It's a virus also, but it's very different than the flu, which we spoke about last week. This is definitely more gastrointestinal, but we'll talk more specifically about flu today. I'm also going to talk about tips to really avoid dehydration and get your child feeling better faster, as well as the number one mistake that parents make when they are taking care of their kids with stomach bugs, and really how to avoid that and make them feel better faster so they can get back to their activities and get back to school. But I know the stomach bug is really like something that parents, even me as a mom, really don't like. It's kind of gross, it's messy, there's vomiting, diarrhea, there's just coming out of both ends at the same time. So it's just something that is really a nuisance, and it's so contagious. It runs around the family, and it's sort of stressful when all the vomiting and diarrhea is occurring. So we're going to talk about what to do, how to prevent it, how to take care of your kids so you're a little bit less stressed, and again, ways to avoid dehydration, because that's really the most important thing. So welcome everyone, I'm Dr. Jen. I'm glad that you can join me today. To give you a little background, I'm an assistant clinical professor of pediatrics at the Icahn School of Medicine at Mount Sinai, and right now I'm here in my private practice office. I've been here for over 20 years, taking care of kids from newborns through young adulthood, and really talking to new parents like you to really help you get the information you need and tips and tricks on what to do when your child is sick, how to keep them healthy. And so we're going to talk a lot today all about the stomach bug and how to treat it and what to do. So first off, as I said, the stomach bug is a virus. It's actually many different viruses. In children, the most common worldwide is rotavirus, and there's other norovirus and adenovirus, but many different viruses can cause the stomach bug. And what are the usual symptoms? Well, to start off with, usually there is vomiting, and then stomach pain and nausea, and then stomach cramps, and then there may be diarrhea as well too. Kids oftentimes get fever, and as well, sometimes adults don't get fever, but kids often get fever when they have a stomach bug. And you want to know, actually, this is actually important because parents are always really concerned. They'll call me and say, well, I thought it was just going to be 24 hours. So everyone always says the 24-hour stomach bug, but I can tell you in kids it always lasts longer than that. So don't be too concerned if it's lasting longer. Sometimes they're better, but they may vomit once or twice, or the diarrhea lasts longer, but that initial vomiting usually should really be done within the first 12 to 24 hours. But so yes, so the stomach bug is usually more than 24 hours when you're talking about children. And with kids, you just have to be so careful. The main reason is, the main complication of a stomach bug is dehydration, and kids just can get dehydrated so much quicker because they're much smaller, much less fluid, and they can get dehydrated quite quickly. So you have to be really careful and diligent, especially in children under the age of 2. So that's why today I really want to talk about how to rehydrate and get your child drinking again and feeling better. That's probably one of the most important things to talk about today. So what other symptoms? As I said, it usually lasts more than 24 hours in kids. And the vomiting, parents always like to describe what's happening when they're vomiting, and they can't believe how much it's projectile and it's coming out, and it's all this food and stuff, and then it becomes clear. And so that's not the normal course. Usually whatever you ate for dinner or the last meal that you had, that's usually what you vomit up first. And then afterwards, it's just like a lot of either bright yellow and clear fluids, a lot of the stomach acids, and there could be retching. And I know it's so hard to see your child like that, but you just you'll be there for them, and we're going to talk specifically about what you can do to help them feel better. And as I said, stomach viruses come in sort of all different shades. The majority are vomiting, and then diarrhea. So we'll talk about that both, but some just have vomiting and some are just stomach bugs that just have diarrhea and your child otherwise feels okay. And we treat those a little bit differently. So I'm going to talk about just diarrhea as well too, and what to look for and what you can do to help your child. So as I said, it's very, very contagious. This is kind of gross, but we say that it's contagious person to person by the fecal oral route. So basically through the poop and the vomiting and the mouth. So if you are helping a child, or you're cleaning up, or your child is sick and they touch you, or they touch someone else in the house, and then you put your hands to your mouth or your nose, then you can get it that way. Or if you change their diaper, you can pass it that way. Or if someone is making food and they have some remnants of either feces or stool, or either from saliva or from vomiting that they didn't wash their hands well enough before cooking or preparing food, it can be spread that way through food, which is different than foodborne illnesses or food poisoning. It's just that the virus then gets passed on from person to person that way as well too. So as you see, it can be very contagious with everything in the home. So you really want to make sure that you do clean the surfaces, and we're going to talk a little bit more about that as well too. But yeah, so it's very, very contagious. So what can you do? I would say, first of all, once you see that your child is having a stomach bug and there's lots of vomiting, kind of like prepare yourself. I think actually as a mom too, like just have to mentally prepare yourself, because you know that there's a good chance as the mom that you may get it too, and then you got to take care of everyone else in your family, right? While you have the stomach virus too. So one of the things is first, get your child all the pajamas out, so it's easy, because they're going to be probably changing them a lot, and bibs, towels as well too, and the bedding. It's really important, and I guess here's a helpful tip. So get lots of sheets out as well as towels, and sort of layer the mattress with a sheet. Hopefully you actually have like a waterproof mattress pad so nothing gets through to the mattress, but then on top of a sheet you can put a towel, and then you put another sheet and a towel, and then if they do get sick you can just sort of peel the layers off one at a time. Makes it a little bit easier, especially when your child is sick in the middle of the night or you're with them. Make sure that you have big garbage bags and garbage cans, because obviously with young kids they don't even know what's happening, and they may just vomit and have diarrhea all over the place, and it obviously gets really, really messy, and it's tiring and frustrating too. So the more you prepare, the better. Again, this is one of those times when disinfecting is like really, really important. So you want to disinfect all those surfaces that are the counters or what have you, or furniture. If you're sitting there in the rocking chair with them, that may be something that you want to make sure that you clean. I know you can't do it all the time, but you want to, if you can, if you're cleaning up a big mess, wear gloves. You can buy disposable gloves. That can be really helpful too, to helping to combat the spread as well too. And the other surfaces that are high use things, so like remote controls for the TV, telephones, iPads or computers, things like that get touched a lot. You want to definitely make sure that you sanitize and clean as well too. And one thing that's really important is washing your hands. And yes, people always want to use hand sanitizer, but to be honest, for things like a stomach bug where there's vomiting and diarrhea, you really want to wash your hands well. That motion of washing your hands just needs soap and water. Do it for a good 30 seconds. That will actually be really, really even more helpful than using hand sanitizer. Hand sanitizer just is something that people may not know, is that if you have any kind of grime at all on your hands, you don't want to just be using hand sanitizers. You have to clean first with soap and water. So make sure that you do that. Will help to decrease the spread throughout your household as well too. So as I said, the biggest risk with stomach viruses is dehydration. So I'm going to talk about that. And get right down to what I said at the beginning is the biggest mistake that parents make when your child has a stomach bug is to go too quickly, offer too many fluids right away, and to try to refeed right away. I always hear parents say to me, but they said they were hungry, they wanted to eat. And I'm like, oh no, don't feed them right away, because they're just going to throw up. Or they're so nervous about the child becoming dehydrated, and this happens a lot, that they're trying right away when they're vomiting to give them fluids. They may try to give them Gatorade, or they may try to give them something to drink right away, and then they just start throwing up more and more, and it's more frustrating, and they can't keep anything down. So I'm going to give you my rundown of tips on what to do if your child has the stomach bug and is vomiting. So first of all, as I said, in most cases, the vomiting is worse within the first 12 hours, sometimes 24, but within the first 12 hours. And your child is not going to get dehydrated right away. So regular healthy child, if they don't eat or drink for 12 hours, they should be okay if they start to rehydrate. So often I tell parents, like, sort of just let them get it out of their system till there's nothing left. And then you want to start really slowly. Even if they're saying, oh, really want to drink, you want to start really slowly. And I recommend starting with ice chips. Just crush up ice, give little pieces in their mouth. One of the reasons is it hydrates slowly because it dissolves slowly, so you're getting a little bit at a time. So ice chips is key. You want to make sure that they can keep the ice chips down before moving on to the next step. So after they have the ice chips and they feel better, it's melting in their mouth, they're not really feeling as sick, you move to step number 2. And step number 2 is giving them sips of water. So you want to start with water. Water is really important for hydration whenever they're sick. If you have vomiting or diarrhea, your body needs a lot of water. So you want to do water. We're going to talk later about moving on to other things, because when you vomit, you do lose sodium, chloride, which is salt, potassium as well too, and your sugar gets depleted. But to start with, it's just best to first start with water. So your aim at the beginning is just for about an ounce every hour. So let's do a little, I'm going to give you like a little bit of a math lesson right now. So an ounce is 30 milliliters, and a teaspoon is about 5 milliliters. So what you can do is give 5 milliliters or a teaspoon about every 5 or 10 minutes or so. And if you do that, then within the hour, if you do that slowly, and then you'll end up with about 30 mLs, which is 1 ounce. So you can do it, I think for the really young kids, doing a dropper, they kind of like to play with it. You can squirt it from the side into the back of their mouth. That can be really helpful to get them to keep it down. And you just want to make sure that you're going really slowly with that. Once they can do that, and then you want to do about the next hour, try to do 2 ounces or so. So they're taking the sips every 5 minutes or so, or you can use the dropper to do that as well too. After that, as I said, then you want to start to replace. Now that you see they're able to tolerate the water, you can move on to what we call clears. So clear fluids are things that you can see through. So really the best would be an oral rehydration solution. So one example would be Pedialyte, but there are others as well too. So this has just the right amount of salts and potassium and sugar in it, so you can make up for what's been depleted. And so what we're trying to do is make up for what they depleted and then their ongoing losses. So they need a little bit more than what they would usually be taking to make up for all that vomiting, and if diarrhea started as well too. So you would start with an oral rehydration solution, and they come flavored or they come plain, whichever your child likes better, you can try. And then once they're doing that, or sometimes I'm going to say some kids just really won't take that, so we move on to the next step, which would be giving something like, for example, Gatorade or diluted apple juice. And the reason why you have to be careful, so it's great, I'd say Gatorade is pretty close to oral rehydration, especially for big kids, but it does have a lot more sugar, and so you want to be careful at the beginning. Sugar and glucose actually helps to decrease nausea and vomiting, so it's actually quite good. But you don't want to keep on going, giving glasses and glasses because of Gatorade, because that will be a lot of sugar. And the sugar then, when you have too much sugar, that can actually make you have diarrhea. So it's sort of this very delicate balancing act. So we want to get some sugar in so they feel better and make up their losses, but you don't want to give too much. So this is a time, if they are taking Gatorade or they're taking juice, apple juice, pear juice, grape juice, you want to dilute that juice with apple juice or grape juice with water, and so they'll be getting some of the sugar that they need. And then another tip is to do popsicles. So these oral rehydration things like Pedialyte come in popsicles. Again, you can really just buy regular popsicles if you're just trying to get sugar into them. Through the fruit juice, you can do that. Through a frozen popsicle, it feels good in the mouth, but also, again, it just dissolves really slowly, so you can sort of control. They're getting the fluid that they need as the ice pop melts, but they're getting it slowly, and it helps to keep it down. So that's a thing to do too. A little trick that I do that kids seem to like once they're drinking the water, but they really don't want to eat anything, is they can take a lollipop, because that's sugar-based too, and then have them dip it in water and then just keep licking it and dipping, and again it gets a little bit of sugar and it helps them to feel better too, helps with their energy as well too. So once they have taken the clears, parents are often sometimes in a rush to give milk. And, milk doesn't cause more mucus in this, or it doesn't make them sick. But if you think about it, like whenever you were sick, like milk is heavy, right? It's like lays there in your stomach and it's going through your intestine. Probably not the best thing when you were just been vomiting a lot. So I just always usually tell parents to hold off on the milk for a day or so, so you really see that your child is eating well. And then we move from the clears right on to some foods that are easy on the stomach. And it's what we call the brat diet, or plain foods, and we use it a lot for diarrhea, which I'm going to talk about. But plain things like, and we want to give small quantities. I think that's really the key. So even if your child says they're really hungry, just start with like a cracker or two. Even rice is really good. It's plain, it's binding. Applesauce, toast. So bananas, rice, applesauce, and toast. But you can add other things in if they're feeling better. Chicken. Once they're feeling better, again, they can have some fruit too. I would just say to go really slowly. It's better to give like a little bit every hour or two, as opposed to like 3 big meals a day, just to make sure that they can tolerate it. And if they aren't tolerating one of the steps, then the key is to go back one step before. So if they seem okay and then they start vomiting once they have the food, then just go back to the liquids. It's okay if your child doesn't eat for a day or so, as long as they're having liquids that have, again, salts and sugars, and the minerals and the vitamins that they need, then they will be okay. They can survive like that. But you don't want to push the food. They'll sort of let you know in general, like when they feel like eating. And so just take it slow when it comes to the food. That will come back. Usually with any sickness, the appetite is usually the last thing to get back. So that's pretty much what I would say. And then obviously just, be careful. Nothing too spicy, nothing too greasy. But again, as much as possible, as they're doing better, you can get them back onto their regular diet, and just make sure that they're well hydrated, meaning that they're urinating frequently, that they're going to the bathroom every few hours or so. They should seem a little bit more perky, and feeling better too. So let me talk a little bit about diarrhea as well too. So you can have a stomach bug that's just stomach pain and diarrhea, or you can have, again, this full-fledged stomach bug that's vomiting and diarrhea. Now, if a child is having just diarrhea, meaning like loose stools a few more times than they usually have, they're fine, they're running around playing. What we usually say, and the best advice, is just to feed through it. If they're happy and they're doing well, you don't need to change anything. They can have their formula, they can have their breast milk, they can have milk. As long as they're doing okay, they can really eat what they want. It's really only when the diarrhea is really severe, or they have really severe stomach cramps, that we want to start limiting, particularly dairy, and I'm going to talk about that in a second. Why? And that's really if you're having protracted diarrhea for long periods of time. When you have diarrhea for long periods of time in kids, sometimes they get a temporary lactose intolerance, where they don't have the ability to absorb those milk sugars. And so if that happens, your pediatrician may say for a while to avoid milk, and if they are still having diarrhea for a few weeks, then they may switch them over temporarily to either soy, or even to almond or other nut or coconut, other milks just that don't have the lactose in them. This will just be helpful until the intestines heal, and after a few weeks, that's what happens. The intestines sort of regenerate, and then they're able again to have those enzymes that they can break down the milk sugars, and then they can have the lactose again. So sometimes you can get a temporary lactose intolerance if you have diarrhea for a long time. It doesn't happen if you just have it for a few days, but in kids they may get a diarrhea that's lasting a long time. So what else? So if you have mild diarrhea, as I said, you can feed through it. But if it's really severe, so you want to start again with the clear liquids, and then if they can tolerate it, that brat diet: bananas, rice, applesauce, and toast. And you don't want to stay on it too long, just until they feel better in a day or so. And then you want to try as much as possible to get back to their regular diet. You want to add in some healthy fats as well too. But you want to do small feeds, so it's sort of like they're snacking or grazing throughout the day. They may have, it's just their intestines are still sore, and so it may be hard to have a whole bolus of food, like a whole meal at once. So small frequent meals when you're getting over diarrhea illness is usually the way to go. It'll be much easier. So one thing, as I said, is, we want to hydrate well. So with diarrhea, you definitely, if they're eating food, you want to make sure that they're drinking a lot of water. One of the biggest mistakes that parents do is that they give them a lot of juice. And the reason why juice is not good for diarrhea is it has so much sugar in it. And what does the sugar do? Well, it actually draws water out of your intestine and makes the diarrhea worse. So you're actually adding to the diarrhea and the complications. So try to avoid juice. Again, if that's the only thing they'll drink, really try to make it half strength or even less, but you want to get a lot of water in them. And eating foods as well too. Those binding foods can be very, very helpful, specifically like things like applesauce, pasta, all those foods that kids usually like, rice, toast, crackers, and things like that. Also, when you have a young kid, or especially an infant or a baby with diarrhea, you want to make sure that you put a lot of diaper cream on them. It's not uncommon to get a diaper rash when a child is having lots of diarrhea. And so the important thing is to slather it on. Put it on like you're doing frosting on a cake. So all over that button, everywhere, you want to put a thick layer on as much as possible. So that's just one of my tips. And you want to look for a cream that has zinc oxide. It's usually those thick white creams that are really hard to wipe off. That's the best. So there's so many different ones. There's butt paste, and there's Desitin, and there is triple paste. Any of those ones that have a thick are thick and white, and the main ingredient, if you look at the active ingredient, says zinc oxide. That will be a great diaper cream if your child has diarrhea or you're worried about getting a diaper rash as well too. So let's see. What else can I tell you? What else can help with when they're having diarrhea? Probiotics actually can be extremely helpful. We know in many studies that's shown that rotavirus, one of the most common causes of diarrhea, can be decreased, as well as some other viruses, if you give probiotics alongside when they're having the diarrhea. It actually can help with your digestion and your immune health all the time. So I am a big proponent of probiotics for everyone. But definitely there are many studies looking at Lactobacillus GG, which is a probiotic that has been shown to be very helpful in children, and definitely can help to decrease the length of diarrhea, especially if you're doing all these things and you're avoiding juice, as I said. It can really help the intestines heal quicker, so your child will be back to normal. What you don't want to do, these are big no-nos, is give your child anti-diarrheal medicines, one like Imodium, and without asking your pediatrician. And it's so rare that I would ever recommend that. Or things like Pepto-Bismol, for a couple of reasons. First of all, Pepto-Bismol turns your poops black, so parents get all freaked out when that happens. But also, regular Pepto-Bismol has aspirin or salicylate in it, and we don't give aspirin to children with viruses specifically, because it can then lead to other issues like Ray's syndrome, which can be very dangerous in kids. So that's one reason. And Imodium, really what Imodium does is, it slows down so your child doesn't have as much diarrhea. But the issue is that it keeps the virus in your body longer. So then they're shedding it for longer. So it's seeming like they may have diarrhea for longer periods of time. So it's better just to get this virus out of the system, to do these steps that I told you to help regenerate and get their intestines working back normally. But we don't want to slow it down. I mean, yes, if there's an emergency and you're on an airplane, that may be a different story. But in general, for children, we call a stomach bug self-limiting, and we don't really treat it even with over-the-counter medications like those. Anything else that I wanted to tell you? Oh, so when do you have to worry when your child, so you're doing such a great job, excuse me, you're doing such a great job taking care of your child, but they're still seeming, whatever you do, that they're throwing up still, or they just look really lethargic, they have high fever and they're cranky, you can't get any fever reducer in them, and they're just, their lips look dry to you, they may be breathing fast, or you think that their heart seems like it's racing. Other things to look out for is wet diapers or going to the bathroom. So in general, they should pee or urinate every 6 to 8 hours at a minimum. And if that's not happening, or their urine smells funny, or it seems really dark, or they're just not having wet diapers all day long. Those are issues that you should always call your pediatrician. Never be scared to call your pediatrician. It's better to err on the safe side. So if any of those symptoms seem to be occurring, it's really important to bring your child in. They will be, examined from head to toe to take their vitals and really make sure that nothing else is going on. There are other reasons for stomach aches as well too. So you as a parent don't have to diagnose everything, but you should know like when to worry or when you need to make the next step of seeing your doctor. Because, just to give you an example, stomach aches can be an ear infection, it could be strep throat, it can also present, it could be appendicitis, it could be a milk intolerance. So there's many different reasons for vomiting or diarrhea or having these symptoms too. So if something just doesn't seem right to you, or you have that mom's instinct that something's wrong, pick up the phone or go to your pediatrician and have your child seen. It's always better to be safe than sorry. And, if you go to your pediatrician and it is a stomach bug, but they are very dehydrated, the next step may be, there are medicines that help the nausea and the vomiting that may be necessary for your child, or in some more severe cases, they may need to get IV fluids. And that's, when they put an IV, a needle in the arm, and they give them fluids directly, it will make them perk up and feel better right away. But obviously that's not our first option. We always want to hydrate orally if we can get a child to drink. So that's really the most important thing as well. And then just to finish up on a note, I discussed that rotavirus is the most common cause of stomach bugs that we see in kids. It's a really common virus. And now it seems it always comes back to this, but there is a vaccine that we've been using. It's been over 10 years now for rotavirus, and it has made a dramatic impact on these stomach viruses and that we are seeing. I have to say, it's so rare now that I actually have to send someone to the emergency room to get this IV hydration because they're severely dehydrated or need to stay in the hospital because of this rotavirus vaccine. It's amazing, especially in really young kids. It has decreased the seriousness. It's decreased rotavirus in general, but also I think it's about 95% has decreased hospitalizations and deaths due to this rotavirus, which is so common in children. So it's amazing that we have these vaccines that we can use them here. I happen to have just been reading, came across this last night, that in Afghanistan they have just now started using the rotavirus vaccine, and there, as you can imagine, they said over 5,000 children die a year of rotavirus due to the conditions and the severeness and how quickly it spreads from person to person and young children. So it's amazing that we now have this vaccine here that works so well, and we're seeing such decreased cases as well as so many decreased complications and illnesses from the rotavirus. So I just wanted you to keep that in mind. Make sure that you go to all your children's well visits and make sure that they stay up to date on their vaccinations, because it really does save lives and helps them feel better, which will make you feel better, secure and confident as well too. So I hope all that information was helpful to you about stomach bugs and your children. And if you take anything home from this today, it would be to make sure that you give them fluids, but that you start really slowly. Start with water, even ice chips, water, and then clears. Just go really slowly. And that way is much better. Even if your child says they're hungry, make sure that they're tolerating the liquids first for 6 to 8 hours before giving them any food, and I think you'll be much happier, and so will they. And just to everyone out there, thanks for listening. I want to also remind everyone about Pediatrician in Your Pocket. That is my new video manual guide for parents. Everything parents need to know while they're on the go, taking care of their baby from newborn to age 2. So if you found this helpful, there's so much more information about pretty much every disease or illness that your child may have as a young child, as well as what to do to keep them healthy and safe, developmental tips and milestones, activities, parenting information about temper tantrums, separation anxiety, what to do. There's just so much information. Sleep, I have videos on there about how to get your child to sleep, nighttime routines, what to do when they wake up. And so much about nutrition, because I know as a mom that's really important. Feeding your kids healthy, how to avoid allergies, how to avoid them being picky eaters as well too. So you can go to my website, drjen.com, find out more about Pediatrician in Your Pocket, and you can download that as well too. So hopefully this information was really helpful for you. I'm in the middle of stomach bug season as well as the flu season. Hopefully your family is staying safe and healthy this winter, and I will see you all next week on What's Up Wednesday. Any comments or questions or anything further you'd like me to answer, please leave below and I will get back to you as soon as I can. Have a great day. This is Dr. Jen for What's Up Wednesday.